I'm going to go over how to do a blood type, RH type, and screen with a antibody screen. So once we've matched our patient with our rec to make sure everything's correct, we're going to label our tubes with the patient's name or their initials. In addition to that, we need an anti-A tube, anti-B, anti-D, D control, R, reverse A, reverse B, screening cell 1, 2, 3, auto control, all with the patient's initials on it. Additionally, we want to prepare a tube with the patient's initials in 2 to 5%, meaning 2 to 5% cell solution, and the name and initials and plasma for the plasma. So we're going to spin down the blood, and we're going to take the plasma, and we're going to put it into the tube labeled plasma. Imagine that. Then we're going to take our red blood cells, and we're going to wash them. How we're going to do that is we're going to fill up a tube with saline and the red blood cells, and we're going to centrifuge it for 60 seconds, and then we're going to pour off all the saline, being careful not to lose our red blood cells. And then we're going to take the red blood cells, we're going to take just enough of the, not just enough blood to where the pipette starts to expand, and we're going to put that in the tube with our tube labeled 2 to 5% with about 1 ml of saline, and we're going to squeeze the bulb to mix it up. Now once we've done that, we're going to get cooking, and so we want to add our clear constituents first. So we're going to take our plasma, and we're going to add 1 drop to screening cell 1, 2, 3 in auto control. In addition to that, to speed things along, we're going to add 2 drops of L-to-LIS, low ionic strength solution. 2 drops to screening cell 1, 2, 3 on auto control. Now these tubes need to sit in on a heating block at 37 degrees for about 15 minutes. So we're going to set those to the side and set a timer for 15 minutes. For our blood type and RH type, we're going to add our a drop of plasma to our reverse A and reverse B, because it's our clear constituent. And then our anti-A is going to go to our anti-A, 1 drop of our anti-B to our anti-B tube, 1 drop of our anti-D reagent to our anti-D tube, and 1 drop of our RH control to our RH control or decon tube. Now we can add our non-clear constituents, which we add A1 to our reverse A and our B cells to our RB. And I forgot to say this, so I'm going to say it now. We need to add 1 before we put our screening cells in our heat block. We need to add our cells. So we're going to add our screening cell 1 to our screening cell 1 tube, our screening cell 2 blood cells to our screening cell 2 tube, and our screening cell 3 to our screening cell 3 tube, 1 drop each. Then they're cooking. So we're going to do our anti-A, anti-B, anti-D, our RH control, reverse A and reverse B in our centrifuge for 15 seconds. That's call it immediate spin. So once we do that, we're being careful to pay attention to the order we take them in and not to shake them up too much yet. We're going to take them out, and we're going to gently wash the supernate over our cell button to kind of take it off the cell or off the tube. And we're going to do the jitters. I like to call it the test anxiety jitters, because I have test anxiety and I jitter. Not too violent. We're not trying to give it shaken baby syndrome. We're just gently shaking to see the reaction in our viewer. And what we're looking for is agglutination, or a chunk, basically. If it's one big solid chunk, it's 4+. If it's a big chunk with maybe some small chunks, it's 3+. If it's chunks, but they're good, decent size, but there's not tons of them, that's 2+. And if there's lots of little chunks, but maybe we can see some cells just kind of free floating but behind it, that's definitely going to be 1+. And if we see no chunks, no agglutination, that's going to be negative. And we want to make sure that after every time we look at a tube, we record the results. So no going through anti-A, anti-B, anti-T, and then recording or walking away talking to our friends. No, it's going to be we read our anti-A, we record it. We read our anti-B, we record it, and so on and so forth until we've done our anti-A, B, in reverse types. And so once we do that, we're good to go, and then we pull out our screening cells, and we are going to add our anti-human globulin polyspecific, DAT, and we're going to do 1 drop to each. And we're going to gently mix it and mix the tubes, and we're going to centrifuge it for 15 seconds. And then once we do that, we're going to, again, test anxiety jitters, and we're going to read the reaction. Now, once we do have to go through and we have to do cell washing. We're going to do our cell washing procedure. We're going to do that 3 to 4 times, and then we're going to read the reactions again. And if they're positive under macroscopic, or not using the microscope, then we're good. We can record the reactions and we're done with that screening cell. If they're negative under macroscopic, then we have to go and confirm it under the microscope. So we're looking under the microscope, and if we see any agglutins, it's positive and we can record it as positive. If it's negative, then we have to add our check cells. And so to anyone that had no reaction at all, we have to do our check cells just to confirm that the reagents are reacting and everything is good. If we don't get any reaction with our check cells, it's valid, and unfortunately, we get a retest. If we do get a reaction with our check cells, then our tests are valid, our results are valid, and we are good to go, and that process is done.